So, on the far left of our size ruler here, we have TIS, which stands for in situ, meaning the cancer is localized. This includes conditions like DCIS, which is cancer confined to the milk ducts, or Paget's disease. Moving down the main ruler, T1 is any tumor less than 2 centimeters. T2 is between 2 and 5 centimeters, and T3 is greater than 5 centimeters. Now here is your absolute essential memory hook for the exam room. 2 for 2, okay? T2 starts right at 2 centimeters. If you can just remember 2 for 2, you can instantly reconstruct this entire ruler in your head. It's a real game changer.
But what happens when the tumor grows beyond just size and starts actually invading? Well, that brings us to T4 staging, which is all about invasion layers. And for this, we have a fantastic mnemonic. I want you to literally say this out loud with me. Can skin create danger? Can stands for chest wall, which is T4A. Skin stands for skin involvement, which is T4B. Create stands for combined, meaning both chest wall and skin, giving us T4C. And danger stands for inflammatory breast cancer, which is T4D.
Let's take a dramatic pause right here to focus on the D in our mnemonic. Danger. The most dangerous thing in the breast is inflammatory breast cancer. This is an absolutely crucial clinical rule you cannot forget.
And here is the clinical significance of that danger. Any inflammatory breast cancer automatically bypasses all of those size rules we just learned. Literally, it doesn't matter what the measuring tape says. No way. If there's inflammation, the presentation immediately jumps all the way to T4D. Actually, scratch that. It doesn't just jump. It overrides the ruler entirely.
Here is the golden rule of end staging. Lymph node staging follows a strict anatomical path, moving from lateral to medial. Look at that large arrow sweeping from the outside of the chest near the armpit inward towards the center. Understanding this lateral to medial progression is the absolute key. As the cancer spreads further inward, the end stage increases. And of course, if there's no regional node involvement at all, well, that's simply N0.
To map out this lateral to medial journey, we have a total masterclass mnemonic. My friend is inspecting breast sores. Let's walk through it together. M is for mobile axillary nodes in the armpit, that's N1. F is for fixed axillary nodes, N2A. I is for internal memory nodes near the breastbone, N2B. Now moving to the N3 category, I is for infraclavicular, meaning below the collarbone, N3A. B is for both axillary and internal memory together, N3B. And S is for supraclavicular, above the collarbone, N3C. Let's move to and see how this builds visually by mapping the first half of our mnemonic directly onto the ribcage. MI represents the mobile ipsilateral axillary nodes, and ipsilateral just means on the same side as the tumor, right at the shoulder joint, and that's N1. As we move slightly inward, friend represents the fixed ipsilateral axillary nodes, becoming N2A. Continuing medial towards the center of the chest, is represents the internal memory nodes, which gives us N2B. You can literally see that lateral to medial path playing out visually right here.
Finally, we conclude the end staging by mapping the inspecting breast sores portion. This hits the anatomical danger zone at the clavicular apex, or the collarbone area. This is the whole N3 category. Inspecting points to the infraclavicular nodes just below the collarbone, N3A. Breast means we have both the axillary and internal mammary nodes involved simultaneously, N3B. And sores takes us to the absolute highest point, the supraclavicular nodes above the collarbone, N3C. As the rule states at the bottom, once you hit infraclavicular, you're looking at combinations or moving up the collarbone area. Okay, I highly encourage you to take a mental snapshot, or honestly, a real screenshot of this visual. This is your exam eve master synthesis. Right at the top, M0 is no metastasis, M1 is distant metastasis. Down the left, you've got your entire T-stage logic, the 2 for 2 size ruler, and the can skin create danger invasion layers. And on the right, your end-stage logic, perfectly aligned with the my friend is inspecting breast sores lateral to medial progression. Everything we've covered interacts perfectly right here in one comprehensive framework.
Here's your clinical scenario. A 48-year-old female presents with a breast mass measuring 4.5 centimeters. On examination, the mass is firmly attached to the underlying chest wall. Palpation reveals ipsilateral axillary lymph nodes that are mobile. Imaging confirms no distant spread. So, what is the clinical TNM stage? Is it A, T2, N1, M0, B, T4A, N1, M0, C, T4B, N2, A, M0, or D, T3, N0, M0? I want you to pause this explainer right now. Analyze the size.
analyze the invasion layer, and analyze the node mobility based on our mnemonics. Pick your option before continuing.
And the correct answer is B, T4A-N1M0. Let's break down exactly why. So the crucial point is how the rules interact. You might have seen 4.5 centimeters and immediately thought, aha, T2 because of the 2 for 2 rule. But look at the next sentence. It's attached to the chest wall. Recall our mnemonic, can skin create danger? Can stands for chest wall, which is T4A, and that completely overrides the size rule. Next up, the nodes are mobile. Recall, my friend is. M is for mobile, which is N1. And finally, no distance spread means M0. If you got that right, fantastic job. This highlights exactly how powerful structured visual learning can be.